A section of members of parliament has castigated the government's handling of the spike of COVID-19 infections among healthcare workers in the country. The lawmakers are accusing the government of grandstanding in ongoing negotiations to ensure the safety and well-being of healthcare workers. On Wednesday, the Kenya Medical Practitioners and Dentists Union told the National Assembly's Health Committee that there is an urgent need to address the plight of Kenyans' outliers in the war against COVID-19 in a bid to avert a looming crisis in the health sector.
On Wednesday, doctors through their representatives appeared before the National Assembly's Health Committee to seek a solution to challenges bedeviling the health sector. The doctors castigating the Ministry of Health for its alleged failure to protect medics from contracting COVID-19.
That the doctors working in the COVID-19 facilities hired through the Ministry and Public Service Commission were put on 6 months contract, which should be ending in February. And their condition as they speak is that there is no cover, they've not been paid, and there's no assurance of compensation. Because the compensation that is going to be announced has excluded all these doctors on contract terms.
The meeting would, however, turn emotional after some members of parliament were moved to tears over the plight of Kenya's healthcare workers.
It is very sad that actually you go to KEMSA, because they have told us level 1, level 2 and level 3, actually there is nothing like a PPEs. And when you go to KEMSA, I think the size of this building here is full of PPEs, and medical staff are dying there because of lack of these things. What is wrong with this? What is wrong with this, with us as Kenyans and as a government?
I wish we were having this meeting in State House with the President chairing. Then all those who he listens to can make their contribution. That is, you remember my definition of the government: the president and the people he listens to. Those are the people we want to listen to. This I don't like this.
All right, easy.
You can't do that to your doctors and your health workers. It's not fair. It's not fair.
Take it easy. We hear you, Mheshimiwa.
It's not fair.
You know, Mheshimiwa, it's painful. Daktari, it's painful, Daktari.
Health cannot be a business.
We hear you, Mheshimiwa.
We are trying to send a message directly to the president, because these things, we are not giving solutions here. We already know them. The solutions are in the cover, they are in the risk allowance, they are in the welfare, they are in the timely salaries of staff. We don't need to discuss. It is very sad and shameful to us as a nation to mistreat our health workers.
According to the Doctors Union, only 20 counties have enlisted their medics on comprehensive medical insurance cover.
Constitutional Health Services Commission that will handle human resources for health be set up so that we do not see all these issues that we're seeing, because it is difficult. In a county, as we speak, it is the prerogative of the governor on how healthcare issues will be handled, from human resources to service delivery.
Let us not condemn devolution as it is. For me, I know that even if we say, let us return back health to the national function, I'm not sure it will solve the problem. We need to see how we can solve the problem of counties and structures of governance.
The doctors want their risk allowance enhanced to include the COVID-19 allowance that they received for only 3 months before it was scrapped.
Madaktari wote, imagine watu wako ICU kisha nyinyi mwache kazi. Can you imagine that, jamani? Hatusemi kwamba hatupendi madaktari, tunawapenda, lakini angalia hiyo crisis itakayotokea. Watu wako ICU, wako HDU, itakuwaje na nyinyi mwache kazi? Mimi naona tusifanye makosa mawili. Kuna makosa yanatokea upande wa daktari, lazima turekebishe, lakini msisema mnaenda kwa strike. Mimi si support strike.
The Health Committee said it will invite the Ministry of Health, Treasury, and the Salaries and Remuneration Commission as it seeks to avert a looming crisis in the health sector.